afternoon, good morning, good evening, depending on where you are in the world today. Welcome to one of our webinars again. This time it's going to be called Reimagination, Recover, Agile and Digital. Again, good afternoon. My name is Kilian Songwe and I am the President at the Global Healthcare Public Foundation. And I'm very glad to have you join me today to do the Reimagine, Recover, Agile and Digital. That's what we need to be looking into as we move into the next new frontier following our COVID experience. And just as we move into that frontier, we've been asked the question a few times, so I just spent a few seconds to talk about who we are. A Global Healthcare Public Foundation has been around for just a little over 17 years now. We're a charitable organization with footprints in over 16 countries and 3 continents. And we are self-certified to 3 very important standards: the ISO 9001, which is the quality management standard, the 14001 environmental management systems, and occupational health and safety, which is the 45001. Both of them International Organization for Standardization standards, which ensures the fact that we do our business with a certain level of accuracy each time that it is done, and the repetitiveness about it is the same. We have a good number of staff based in our Uganda office. We have a huge number of collaborations and a good number of partners that we work with. So just to be able to get started, we are in the COVID era, and I don't want to make light of it, but I want to bring our attention to what phase of the COVID response we are in, or COVID transmission we are in today. So we're well past phase 1 where there were no cases. I remember the case of Uganda is one of the world's best stories because for a very long time, while other countries were showing huge numbers, Uganda was very comfortable at zero cases for a long time. And then we went to a few sporadic cases just before we closed down the airports, closed our frontier, and then to a few clusters because of the people who came in there. And then now we've moved into community transmission. As I speak today, we have well over 12,000 cases, and this is clearly in the community transmission area. And so COVID is real, and we need to look at it. And it's on this backdrop that we have the discussion about how do we recover our organization, our businesses, and as individuals to be able to get on and move into the next phase. So as we think about that, again, just so that we know, these are just the different rates of transmission, percentage transmission. I mean, so much has been said about symptomatic transmission and following of contacts. But there is another number which I really want people to pay attention to, and that's the 10% environmental transmission. That transmission is very important because one of the big issues that we have today is compliance. And compliance to what? Compliance to people washing their hands, compliance to people sanitizing, and most important, compliance to we're having some kind of a face wear. It's very important because as you see, there is 10% transmission that is going to happen just from environmental contact without you actually having to get in contact with somebody who is symptomatic or forget pre-symptomatic. And again, if you think about the reproduction rate, if the reproduction rate is still somewhere between 2 and 3, which means that for every infection, there is a potential for 2 or 3 other people to get infected, that becomes pretty serious. So think about your 10% COVID transmission possibility, and then an infection reproduction rate of 2 to 3. That still tells us that there is a lot of work that needs to be done to be able to ensure that we can curb the transmission. So with that backdrop, I just threw in these pictures just so that we can have a good sense of the fact that, yes, the temperature guns are available, but we need to make sure that the temperature guns are actually working at a temperature which is recognized. Then there are symptomatic patients in the middle of the screen. And then, of course, the good news is there are people who have recovered. We would like to see the recovery rate increase. That would be something that we certainly want to see, but that is going to happen with time. So going to where we are today, these are the signs that you see in a lot of places as different organizations come back to business. We are opening soon, come on in, we're open, welcome back, now open. There is some excitement around all of these intentions to open, and people are opening. So to be able to start, we talk about recover, and we say agile and digital. There is a small story I want to share with you, and that's the story of Macy's and Target. Both of them are big stores, very big brands that are known around the US, I would say. And Macy's has been known for the quality of its clothes and the brands that it carries. And over the years, it's been a go-to place to shop for accessories, whether it's women's bags, belts for men's trousers, or jewelry, or any of those kinds of things. And Target, on the other hand, it's a small, nice, convenient shop with multiple aisles. You could pick up some clothing. They run a pharmacy, they run a book section, they run a household section. They're just a small, nice, convenient shop compared to Macy's. But when you look at the two shops, the two businesses, during the COVID era, Macy's actually closed. And so, yes, everybody's going to wonder, how did Macy's close? Macy's closed down almost 72 of its outlets and is threatening to keep a good number of them closed permanently following the COVID pandemic and the lockdowns. Why? The question is, what was Macy's essential component? People could survive without the items that Macy's carried. People could survive with the clothes they had on. People could survive with the jewelry they had. People could survive with the suits they had, or the jewelry they had, or whatever they had, they could survive with. On the contrary, in Target, if you needed medication, you truly needed a pharmacy. You couldn't survive without the medication. And so the pharmacy at Target became Target's essential component. So while Macy's, on the other hand, closed down, Target actually stayed open. Its stakeholders were actually glad. Business improved because everybody now came to Target. And then when you walk through the aisles to get to the pharmacy, which is usually at the back of the room, by the time you get to the back to get to the pharmacy section, you've gone past the book section, you've gone past the house section, you've gone past the clothing, you've gone past a lot of aisles, and you're tempted to pick up something before you return and check out. So Target's essential element, actually, the pharmacy, was able to keep Target in business through these very difficult times. And so I asked the question, what's your essential component as an organization, as a business, or even as an individual? Because you need to harness the strengths around your essential component to be able to stand whatever the storms would be when the storms come. So this whole conversation is based on one of the International Organization for Standardization standard, the 9001-2015 standard. This is actually the base of a lot of the management system standards. It is part of the high-level standards. It basically it talks about quality management systems. Quality management system and the ISO 9001, where the PDCA cycle is a cycle that almost everybody who has interacted with TQM or some kind of a quality system has come to know. The plan, do, check, and act. But what is important when we look at this in terms of business and organizations going forward, there are three essential components that have to come into play. Component number one is, what is the organization context? Where is the organization actually working in? Then, of course, there are the customer requirements. The customers are very clear about what they want. The customer wants a t-shirt, and he also wants the t-shirt to be XL. Now you have to figure out, is it an XL American, is it an XL Australian, or is it an XL Uganda? You need to figure out which XL the customer wants. But the customer is pretty clear about what they want. Then there are needs and expectations of interested parties. People want a return on investment, and they want it in the next 6 months. They don't want it in 15 months. So all of those things come into the quality management system to ensure that there is the appropriate planning, there is the right support and operations to be able to ensure that the mechanisms work the way they're supposed to work. Whatever the policies are that allow for the actions to happen in the do stage actually get executed as intended or as stated by the planning phase. Then, of course, there is going to be performance evaluation. In performance evaluation, you're essentially looking back to say the things that were planned for and the activities that were actually carried out, did they meet the requirements as expected by either the customer or the interested party in the context in which you're working in. And the context basically is the political environment in which you're working in, or internally, it could be the quality of the staff that you have. Once that evaluation is done, then you need to make a check and see how the evaluation went, and then make improvements. The PDCA cycle has been around for a very, very long time, and so everybody has come to accept ACT. And at the foundation, we want to change ACT because you've already done something to adjustments. So you've done a performance evaluation, you've made some improvements, and now you want to make some adjustments to your next planning phase. What you get as a result is you have increased customer satisfaction, and the product and service that you deliver becomes a quality product and or service. So when we talk about context of the organization, we need to first of all understand, what is this organization? All organizations, all offices are basically an arrangement of entities. And those entities absolutely have to come to play in the right mix. Because if they're not in the right mix, what you're going to have is you're going to have problems. So arrangements of entities aimed at accomplishing a purpose. And what is your defined purpose in this case? You need to, there is a clear project that needs to be undertaken. So within the context, as I said earlier on, there are external and internal context natures that you have to look at. On the external side, what is of great interest in this conversation is the customer. Because we're talking about reimagination. If you're going to reimagine where the customer wants to go, and you want to reimagine your business, you have to be very careful, and you have to listen to the customer very intently to be sure that you can satisfy the customer's requirements. Because of course, there are other elements like the quality issues, international experience. Are you competing against local firms, or are you competing with other international firms? Experienced workforce. Experienced workforce is very key. It's very key in terms of ensuring that everything that you want to do is actually done and it meets standards that are appreciated by the people out there. Then, of course, there is the internal environment. Within the internal environment, we're going to talk about technology, and specifically, we're going to be talking about the digital capabilities that your organization has. That is very, very key to be able to look and to be able to go forward. But as we talk about that, there is also the element of the threats and weaknesses in the organization. And PESTEL is an acronym that has been used for a long time now when you're looking at the organization and looking at the different parts of PESTEL. Basically, what's the political environment in which you're working in? What's the economic environment, the social environment, and then of course the elements of technology that you're using, and what's the legal comfort, and most recently, ethical issues have also been brought to bear in this whole PESTEL equation, looking at your threats and weaknesses. Then, of course, within ISO 9001, in the business context, the question of the SWOT analysis has been brought up many times. Basically, what are your strengths? What are your weaknesses? What are your opportunities? And what are the threats that your organization is going to face? There's just three very basic questions that I put with this, with regards to this, that we need to think about. If you're looking at your strengths, it says basically, what do you do well? Again, going back to the essential component of your business, what do you do well? Because you need to think about how you're going to do it even better and faster to be able to move into the new era. What are the weaknesses? What could you improve? There are things that you could certainly improve based on the fact that you've done a risk analysis of your business or your operations to date. And then, of course, there are certainly opportunities. How can you turn your strengths into opportunities, or how can you turn some of your weaknesses into opportunities? And then threats, what threats could harm you? This is very, very important. You need to look at your essential component and do a simple risk analysis around your essential component and see what could potentially harm you. Is there a bigger industry player who is coming to bear in the market? And if there is a bigger industry player coming to bear in the market, you need to be able to know them and see how you defend yourself against them. Then, thinking about needs and expectations of interested parties. This slide has three columns to it. And within the three columns, It basically has 3 columns to it, and within the 3 columns, what you have is a stakeholder satisfaction, you have the stakeholders in the middle, you have the stakeholder contribution. This is a rather important slide because if we just looked at the first row at the top, it talks about stakeholder satisfaction, it talks about fast. So as an organization or any entity, you have to be able to look at your stakeholders and make a very simple measure. So there is a very simple codification that is used there. There is C for the current engagement of your stakeholder and D for the desired engagement of that stakeholder. So if you look at stakeholder number one, it is the organization's wish that stakeholder number one is actually leading, is out there actually talking about the company, doing some good things for the company. And the current status of stakeholder number one is in leading. That is an excellent place to have your stakeholder. If you look at row 2, it says that the desired engagement of stakeholder number 2, you like for stakeholder number 2 to be in a neutral position. However, stakeholder number 2 is sitting in the unaware column, which means they don't know anything about your business or they don't know enough to be able to help you. So as an organization, your job now is to be able to move stakeholder number 2 from being unaware to being in a neutral position. Same like stakeholder number 3, you would like stakeholder number 3 to be very supportive, to be able to engage when there are activities that are going on. But stakeholder number 3 is sitting in a very, very interesting place because they're on a part of the column that says resistant, which means they're actually resistant to the progress that the business is actually going to be able to make. So it becomes the organization's effort to move stakeholder number 3 from the resistant position into a supportive position. That is very important to do. Same as stakeholder number 4, we would like to have stakeholder number 4 in a leading position. We would like to have them out there as the chairperson for the organization, but now they're in a neutral situation. Now we need to be able to do something to move stakeholder number 4 from a neutral position into a leading position. In terms of doing this, what we need to be able to look at, therefore, is this is a very simple example of what is actually going on today. Somebody wants to buy a car. Why would they want to buy the car? The reason why they want to buy the car is because they don't want to go into a crowded place. Public transport is not as safe as they would like for public transport to be, but they don't want to go into a car dealership to buy the car. So now the car dealership has to be able to make sure that they have enough cars so that they do not frustrate their customers when the customers come in to ask for a very specific model of the car. So the dealership has to now be able to say, what do customers actually want, and ensure that they have a supply chain that can satisfy the customers so that they do not get frustrated. They have to gather more information, use more information channels, because on the other hand, the customer is doing most of their work online. So because they're not coming to the showroom to look at what cars are in the showroom, they're actually doing it from their computers at home and making decisions from home about what cars they are going to want to use. So in turn, the dealership has to hire new drivers, has to hire many more drivers, because when the customer looks at the car from home and they want to test drive the car to make sure that they'll make a decision about buying or not buying, the car needs to get to them at their home. So the dealership or the car showroom has to make the decision of hiring more drivers so that the drivers can take the cars out to the different customers where they need the cars to be able to test driving. So the element of the digital capability becomes very important in terms of knowing how many people are hitting your website, because if you can guess how many people are hitting your website, that could give you a good average or sense as to how many cars you need to have on the lot to be able to sell. Still in the area of essential component, what is your essential component? During the lockdown, one of the industries that was really hit hard was the airline industry. In June of 2020, IATA, the International Air Transport Association, reported that the airline industry lost $314 billion United States dollars from passengers who were not traveling. That's huge. But at the same time, IATA also noted that the next big wave in the airline industry is going to be cargo. It expects cargo to grow by 20 to 30%. That's a huge growth. So a lot of the airlines are now beginning to say to themselves, every airline that had a cargo division is now looking at the cargo division as its essential component and is thinking, how do we grow our cargo division? Because very clearly the cargo division is going to be what is going to keep the airlines in the sky. So just for show, we're talking about FedEx and DHL, and there are other cargo airlines that are out there. So as we move over to Agile, from essential component to Agile, you've recovered. Now that you've recovered, you need to make some changes. I don't know how many of you remember the Falkland Wars. The Falkland Wars was fought in Argentina. Back then, Margaret Thatcher was the Prime Minister in England, and Ronald Reagan was President of the United States. And when they went down to the Falkland Wars, they were given a very good beating by the Argentinians back then. This is, I think, 1982. That's when the Falkland Wars happened. And then there was a very big question at the time when this happened. And the question was very simple. People wanted to know, why did intelligent people sit there waiting to be told what to do? Why didn't they just get on and do it? Yeah, because everybody understood that the British army were very intelligent people. And people wondered, how did the Argentinians manage that set of people? And that's how we came to the birth of a new system was introduced called Mission Command. Today it's called the task force, it's called the nerve center. There are all kinds of verbiage that is being used today to describe Mission Command, which will now be called Agile. And that's basically, it's the response and having to move the response to lower levels so that decisions could be made faster and disrupt the army and disrupt the enemy, sorry. So what happened with the British Army is they lost the Falkland Wars because all the decisions were made from the top. Now coming in with Mission Command, these decisions were now decentralized and they could be made from lower levels. And that's an element that we need to look at as we go into the next normal. Because what you're going to have as we go into the next normal is basically decisions that would have taken a long chain. For example, what you see on your left hand of the screen, a decision, an idea that comes up in A has to do the journey through B up to D, down to G, and then to J before it can go to market. As opposed to, if you had an agile system, the idea starts off in A, it bounces off to the ends, and the whole team, all the teams come together, they meet quarterly, they make the decisions that they need to make, and you have your product that is easy to go to market at that point. Now, looking at the environment in which we are moving into, there are a number of things that are important to look at. So on our axis here, we have extent of exposure against proximity of exposure. So how long are you going to be exposed and how close are you going to be when you're exposed? That becomes very crucial in thinking about the infection and transmission that we spoke to at the beginning. So as we go back to work, there are a couple of places where you're working in a small office and it's not crowded, you're not dealing with too many people from the public. Then yes, it says your proximity to exposure is less. However, extent of exposure, if you have a client who comes in and sits with you and you have to book an airline ticket with them and the internet is not as fast as it's supposed to be, then you have the client sitting in front of you for another half hour or a whole hour. So your extent to exposure is high. On the other hand, you could have low extent to exposure and proximity of exposure is also low. I'm looking here at the fine art theaters. Very few people are actually getting up in the COVID era and looking for an art center to go to. Or the people in construction, landscaping. Most people who are doing landscaping or real estate are usually alone. They're actually working out in their farms, they're sitting on their tractors and doing the work that they want to do. So extent to exposure is low, proximity of exposure is low. They're kind of sort of solo. But then there is the big question, the question here of what is going on at airports, hospitals. Public transit has been a very big question in trying to manage how many people can be in a public bus at any given time. And gyms, markets, this is where certainly extent of exposure is high, proximity of exposure is also very high. And that's an area when if you're in business, you're running an organization, you want to look at what's your relationships to any of these areas, because it's going to directly affect your people. Then, of course, proximity of exposure is high, but extent of exposure is low. We're looking at barber shops, spas, nursing homes, or actually even universities. A lot of the people who are on the university campus are kind of touch and go. So you are in front of somebody for less than 10 minutes, and then you're off to the next place where you need to be. This is a very important slide because we're thinking about, in this slide, we're thinking about how do you make the workplace acceptable for people to come back. So you need to reimagine a workplace that allows for people to be in very different areas as they work. You need to look at the risk factors that might be associated. So here we look at risk in 3 different phases. There's crisis management, which is the beginning of the risk analysis. Do you have and can you keep your staff? There is the risk management itself. What risks require merger? What are the risks that you think you can sell off? And then there is change management once you've gone through the crisis management and risk management. How do we measure the progress of what we're actually doing? So as we go through this now, levels of business that have to change. As we move forward in an agile system where we can make decisions quickly, there are 5 key things that we need to be able to respond to. And basically those key things are, what is your new destination? What's your essential component? At what levels are decisions going to be made? How agile are you? And where are you going to? Do you have a plan to manage your essential component in? And do you have a plan to ensure that the agility of your business is going to be sustained? What resources do you have? How are you going to measure the progress? And what are the new risks that you're going to encounter as you move in this direction? Very simple, straightforward questions that we ask these days. Who are we? What's your essential component? What is your North Star? How should you create value going forward? Everything that you had before the pandemic, people kind of got used to it, but now the customers' demands have changed. How are you going to create new value for the customers' demands going forward? How do you ensure that your essential component actually is able to carry you forward? How are we going to operate? This is the area of being agile. We need to have new power centers so that the decisions can be made faster to support the demand of customers. And then we need to learn how to learn. A lot of people have been introduced to Zoom and all the other handles that you could use to have meetings and communications. But a lot of people still don't know how to raise their hands when you're on a Zoom call or something like that. So we now need to learn how to learn. We now need to embrace data to be able to go forward. So that capability, you take your essential component and you transform it into a digital tool that allows you to reach more customers and do it very easily. We need to translate the strategy. We need to reduce time to market, and we need to do continuous improvement. Basically, yes, this is how we've been doing it. How can we make it better? Learning organizations, yes, we're going to have to learn a lot of things in the digital age to be able to stay competitive, and innovation is going to be key to what we do. Now, when you look at these 5 phases, it actually lends us to what I'm going to show you next. This is where we are today, and this is what we see. You could be at home, and with a simple gadget, your doctor could know exactly what your blood pressure is for the day. You don't need to go to the hospital. You could be at home, and with a few clicks from your phone, you could actually make a huge money transfer. You could pay a bill. You could do many things from your phone. So the whole digital capability is becoming very important. And that also leads to information security. That's one of the important standards out there, the ISO 27001, because there is personal information on the left-hand side about your personal health that is going to be transmitted to your doctors. And on the other hand, there is business information. You're moving money from your phone, from your bank to another client, to a vendor, and you're doing this over space. And this information needs to be gathered so that we know that it's going safely. So as we talk about this, I just wanted to take the theory and put it into a very practical scenario. And in this practical scenario, I'm going to talk about something that we at the Global Healthcare did as we prepared for the lockdown. As we prepared for the lockdown, we went through a number of scenario plannings, and we had to answer three very simple questions. When were we going to lock down? We had already seen the waves in Asia, we had seen the waves in Europe, and we had begun to see the waves as we went to the United States. So we had to make some decisions as to when we were going to lock down, how we were going to lock down, and what we would do if we actually had to lock down. Those were decisions we had to make, and we had to do some scenarios around it. And the phrase simply says, pause to assess, and then anticipate, then act. So we had time enough to think about when do we want to lock down, what we shall do when we lock down, and how we shall continue to stay in business when we lock down. The next slide is actually the slide of my life. This used to be my view every 10 to 15 days. This was exactly my view. I watched the sun set above the clouds, and I'll be going to another destination. But now when I think about what our essential component is and what we've had to do in the digital space, this is my new life now. I'm able to sit in the same place. And in this slide, you see we have colleagues from South Africa working in Uganda. We're working with one of our labs in Uganda. And all of these people are sitting in very different places, yet we're still able to go on and carry out the exercise as we intended to. In this other slide, you have people from Canada, Ivory Coast, Senegal, and Uganda, all in the same meeting, carrying out the same exercise at the exact same time. So I've actually missed my view, my great view of the sunset above the clouds every 10 to 15 days, because this is the next divide. This is the next logical go-to place, the digital world. So your digital capabilities is going to be very key for you to be able to move forward in the new world. So how did we do this? How did we get ready to restart? As we did the restart, again, we did a number of scenarios, and we had to answer some really basic questions. Workforce protection and communication. We needed to ensure that our workforce was very safe, and we needed to communicate with them as much as possible to ensure the fact that they had all the information not to be anxious, because the pandemic was new, too many unanswered questions, and people needed to be kept safe. Then also, we needed to engage our customers. We needed to engage the customers, and we also needed to watch very closely our financial stress, because we need to be able to continue to run the business the way the business was meant to be run. So these scenarios we played, it allowed us to be able to open in good time and continue to conduct business while we looked at a number of things that I would like to share with people to have in consideration as they reopen. The first one is the human resource. You need to think about, is everybody going to be able to come back to the workspace? What changes do you need resource in place? Something as simple as the face mask or some kind of cloth mask to ensure that everybody, you can reduce the potential of transmission. In some cases, it will mean that the offices had to provide, or your organization has to provide for the staff. Office space, is it the reception area? Is it the regular office space? Is it the receiving area? A lot of changes have to be made in these different places to be able to accept this. Posters are very important because it basically reminds people of things they might have forgotten. For example, you have a poster in the washroom that reminds people that they're supposed to wash their hands. Very important poster. Elements of ensuring delivery. So what we did at the foundation is all deliveries came to a specific place. We sanitize them with a spray, hold them out in that area before we get them into our office space. Very important. Making sure that we had a good stock on our inventory was also important, because during the pandemic, there was a very huge shortage of supplies. So following up on your inventory is key as you prepare for the new restart, because you're not going to most probably need the same kinds of volumes as you had before. We did team breakfast because we had some of our staff working offsite, bringing people together every once in a while. And then succession planning. Who is going to be replacing the next person should somebody be infected or should somebody be ill, who is going to be taking over? Then, of course, we introduced the temperature guns and made it mandatory to take temperatures at least twice a day, ensuring that we could actually follow our staff and see if there were any symptoms building. So, going forward, there is what we actually know today, which is just in time. That's where we are today. And a lot of the people who are familiar with TQM, Total Quality Management, know just in time. But we need to move from just in time to just in time and just in case supply. Just in case we have lockdown, do I have enough supplies to continue to provide to my clients? And then the next thing here is actually looking to ensure that when we move from just in time to just in time supply, we're also able to say, we're not just simply returning, but we have to return and reimagine. So as you return and you reimagine, you're basically saying to yourself, you've been doing business on this shore. What is your next shore? And that's where all businesses need to be thinking. All businesses need to be thinking, where do I move from here? So there are just 4 simple imperatives that I leave with. And those 4 imperatives basically say, we need to have a planned recovery revenue. We need to start rebuilding our operations to be able to respond to what is going on. And our 3 and 4, we need to rethink the organization. What is our essential component? We need to rethink that. And as well as rethinking the organization and ensuring that our North Star is still our North Star, we need to be able to accelerate and the adoption of the digital solutions, because everybody's going to be doing something that they want to do digitally. So very simple, quick questions for you here, and we'll be glad to work with you in this area. The question is, do you have a resumption plan? Has it already been implemented? Is it completed? Are you still developing an implementation plan? Have you actually started it? Or are you still just hoping and waiting that things will return to normal? And who is responsible for managing the plan at the different phases? This is something that at the Global Healthcare Public Foundation, we'll be very glad to work with different organizations as they look into their implementation and to return to business. As we return to business, the world becomes truly a global market. And for you to compete in a global market, it is very important that you are yourself certified to a number of the standards that are recognized in the business. I started off by saying that we're going to do this based on ISO 9001, which is quality management systems. And then there is the 14,001 environmental management system, 45,000 occupational health and safety, which also deals heavily on bio-risk, information security. Information security, I cannot overemphasize how important information security is going to be as everything becomes more digitalized. Then, of course, there is the standard on risk management. So, my parting words to you is reimagination, reimagination, reimagination. We need to think about where we're going to, what is our North Star, how do we recover, how do we become more agile, and what is going to be our digital components to our recovery. Because the world is only going to get bigger, the stronger ones are going to buy out the smaller ones, they're going to become better, and it's all going to become faster. So bigger, better, faster is where we're going to in the new world, and you have to do a lot of reimagination here. So my 3 questions for you as I get ready to close out, my 3 simple questions for you is, what is your recovery plan? What is your mission command code? And what is your digital capability? We all need to be able to sit back, think about this, figure out where we are to be able to be part of the next new era. Again, I never want to close. Always talking about the safety, stay safe. We need to take our temperatures when possible, sanitize, wash your hands for at least 20 seconds. Have some kind of face wear all the time to be able to ensure that there is no transmission. And in spite of all of those things, there is nothing as important as maintaining a social distance. Social distancing is very, very important for us to be able to continue to manage the spread of COVID. Well, assume that this was very straightforward. I mean, the ISO 9001, which is standard to which we are ourselves certified to, is a very simple, straightforward standard, which allows for you to ensure that the management systems that you have in place ensure the productivity of your workforce, ensure the reliability of the service that you actually end up providing, and ensures the product that you end up sending to market that is made the same way every time with the same conditions. So this is something that I strongly recommend, at least for starters. Get your organization certified to ISO 9001. For starters, it's going to be a very good place to be able to start to implement some of the other management system standards, especially 27001 for information security. As we move to, a lot of people are beginning to get cloud space. It's very important to get a certification that says that information is secure. I thank you so much for joining us today. I look forward to seeing you next week, same time, same place. Most probably we'll have a much better internet then. Thank you. Have a wonderful week.